Hi there, I'm Dr. Mark Vance, and Dr. Jason West asked me to give you a presentation today talking about colitis. And I'm really excited about doing this. Now, colitis is any kind of inflammatory bowel disease, and there's a few different kinds. It could be just a mucus colitis, which is just the inside lining of the bowels, gets a little bit inflamed, a little more mucousy than normal. That's uncomfortable, not much fun, but it's not real terrible either. Or there's two other kinds. There's ulcerative colitis and Crohn's disease, which can cause various ulcerations or even fissures within the bowels themselves. And we'll talk more about them in just a minute. Now, colitis, by definition, of course, it's irritation, inflammation in the bowels, but it tends to get worse when there's any kind of stress going on. It can be irritated by parasites versus various bacteria, yeast, fungus. Certain immunizations at times can cause irritation on this. Really easy when somebody has a colitis flare for people to get very dehydrated very quickly. They really can't eat anything, they have a hard time drinking things, and they get a lot of diarrhea. So it's very important to stay hydrated as much as humanly possible when you have a colitis flare. Symptoms of colitis include diarrhea. It can be watery. There can be some mucus in there. People get weak, worn out, tired. They don't have any nutrients left in their body. They can lose a lot of weight. They get a lot of belly pains, cramps, aching, lose a lot of fluids, get really dehydrated. And it's a bad sign when there's blood in the stool. That tends to mean it's a worse inflammation than typical. Ulcerative colitis is little ulcerations that can get worse and worse, and it tends to start right down the bottom end, kind of the rear end, if you will, and work upwards through the colon. And it can cause all kinds of problems, can be absolutely miserable. Sometimes people have other symptoms in their bodies too, aches in the joints, skin rashes or inflammation, eye problems. Now, if it's just in the rectum, no place else, sometimes we call it a proctitis. But either way, it's irritation and inflammation going throughout the colon. The distal colon in particular, but it can go through the whole colon if needs be. Now here's a picture of some ulcerative colitis. Very mild case, there's a bunch of little tiny spots, little white spots on there, and they're little tiny ulcerations. And again, this is a pretty mild case of it. Now Crohn's disease is the exact same thing. It causes the ulcerations, and they can get big and nasty and ugly and horrible. You can get the same symptoms, diarrhea, gas, bloating, cramping, blood in the stools. But the difference is that whereas the ulcerative colitis starts at the rear end, the distal end of the colon, which is your rear end, the Crohn's disease can be anywhere. It can be anywhere throughout the bowels. It can be the small intestine, large intestine, stomach, esophagus, most often in the colon and the small intestine. Both of them are absolutely miserable. Here's a picture of Crohn's disease. There's a lot of irritation, redness, inflammation, ulcerations in there. Here's another picture. This one's a little more of a chronic thing. It can go on for weeks or months at a time. And even when it heals up, you can get these scar tissues along the side of the colon or the bowels. And that's what these white lines in there are. They're just scar tissue from where they've previously been inflamed. So how do we treat it? In the regular medical world, if somebody comes in to see me in the emergency room, and I work in the emergency room quite a bit, first thing we do is we give them steroids. Steroids are great. They cool things down. They calm things down. They're wonderful for the short term, terrible for the long term, and a lot of people have a hard time getting off of steroid medications. There's various anti-inflammatory medicines that we can use that are specifically for the bowel. There's budesonide 5-ASA. And there's some disease-modifying medications, the Imuran, methotrexate, some of these other ones that can kind of cool things down somewhat. There's the anti-TNF medications. There's the Remicade, the Humira. These are very expensive medicines that come in the IV every now and then, and they can help quite a bit. But all of the above ones, with the possible exception of the anti-inflammatory ones, but all of the other ones can cause a big problem if you get any kind of infection. Big, big problems, because they cut down your body's immune system, down your body's ability to fight against infection. They recommend don't use antibiotics unless there's a specific infection you're fighting, but it's not uncommon that people have to go to surgery, and they'll yank out part of the bowel, take out anywhere from a couple inches to several feet of bowel. And then oftentimes they'll have to kind of hook it up so you have an ostomy bag, get poop out of your stomach here for a bit until things cool down enough that they can rehook it down to the rear end where things are supposed to be hooked up. Now, at the West Clinic, we have a lot of other options that we use besides any of those. We have several different supplements that work fantastic to kind of cool things down in the gut. We've got Gastrex, we've got Phosfood, Ochrapepsin, Cataplex, Cyruta Plus, and all these are really, really good for cooling down things in the bowels. We have some homeopathic remedies. There's Argentum Complemed, there's Anacardium Complemed. And then we have treatments for various parasites, because sometimes that's the problem. We've got Zymex, Bontifuge, and then some homeopathic treatments for the parasites as well. Additionally, we have some other therapies that are just fantastic. We use ozone. And we actually, yes, we put ozone up where the sun don't shine. And we put some, that's ozone, which is O3. It's a form of oxygen, plus mostly oxygen in there as well. And it goes in and fights any kind of infection. It cools down any inflammation. And it does a really good job of just cooling things down in the bowels. You can actually drink ozonated water, and sometimes we'll actually put ozone in the blood. We'll pull some blood out, put some ozone in it, and stick it back in. That's your major autohemotherapy in the hyperbaric ozone. In addition to ozone therapy, we have a medication that we can use called low-dose naltrexone. This one has none of the side effects that all those other medications have, and it works really, really well for Crohn's disease. In fact, they did a study at Penn State. It was a small study, but nonetheless, of the people that were enrolled, 2/3 of them who had severe, moderate to severe, or severe Crohn's disease, it brought them down to mild disease, and there was 1/4 of them that got 100% better just with this medication. Wonderful medication, not typically used in regular medicine. I won't get into why at this point. Now, there's also another therapy called low-dose allergen therapy or low-dose immunotherapy. These are therapies that can work really, really well at telling your body, hey, all this stuff you've been fighting against so hard, just kind of relax. Be friends. Friend them on Facebook. Let's just get along, man. Give peace a chance. And these medications, when we get the right dose, and sometimes it's a little tricky getting there, but when we get the right dose on these medications, people can sometimes wake up in the morning and feel, I feel better. So these are just some of the treatments that we have at the West Clinic. We'd love to have you come on down, check us out. Feel free to give us a call, 208-232-3216. Visit online at thewestclinic.com. And we'd love to have you come on down to Pocatello. And just remember, just because you haven't found a cure doesn't mean there isn't one. This is Dr. Vance signing out. Have a great day.